Good afternoon, everyone. I'm Dr. Shreoshee Ghosh, and under the guidance and innovation of Dr. Partha Roy, I'm here to present that VEP amplitude and latency are unrelated variables, and that amplitude is reduced in retinal disease. So there has been a huge discussion regarding retinal and optic nerve disorders and how we investigate them, in which ERG and VEP have been differentiated, where VEP is basically for optic nerve dysfunction and ERG for retina. This belief ignores the basic fact that for a VEP response to be evoked, a retina has to be intact. So to prove that VEP parameters are affected in retinal diseases as well, we have employed a strategy to find out whether the amplitude and latency are related or not, both in healthy eyes and in retinal disease patients. Here we aim to segregate that retina is the seat of electricity generation, which is being represented by amplitude, and optic nerve is the vehicle for electricity conduction, represented by latency. So here we have compared our optic nerve pathway to the generation of current in an electric bulb, where electric action potential is being generated in the retina as generator, and conduction is through the optic nerve. So this is an institutional-based cross-sectional observational study done in AIOC Kolkata for 1 year, 6 months, where we have taken a population of 130 normal volunteers with BCVA 6/6, and we have performed pattern reversal VEP on Retimax machine. 2 variables have been taken, N75 P100 amplitude and P100 latency. Another group is a sample of retinal disease patients which had been referred from the OPD to our lab, and a parameter of 16 eyes of 9 patients suffering from various retinal diseases were included. The results that we got in the normative data group, we see that the R, that's the Pearson's coefficient of linear correlation, is 0.1 for right eye and 0.02 for left eye, which shows that there is no relation between the latency and amplitude. And a similar finding was found also in the retinal disease patients, both for right eye and left eye. We have also seen that there is severe reduction of N75 P100 amplitudes of both eyes, but there's retention of absolute normal latency in the retinal disease patients. Further analysis showed that in normative data group, we can see that the points are clustered along a normal horizontal line, showing that there is again no relation between the X and Y axis, and a similar finding has been found out in the retinal disease as well. So in conclusion, I would say that probably in literature there has been no such study where a relation between these 2 variables has been undertaken. And for retinal disease, a definitive pattern has been, we have tried to evolve a pattern through this study. Maybe this is an expression of the all or none law that still needs to be investigated. And through this, it is helpful for those centers which do not have an ERG machine, and they can, only with the presence of the VEP machine, they can try and differentiate between a optic nerve disorder and retinal disorder. Thank you.
Thank you, doctor.
130 normal.
So 130 normal, and the retinal group 16, because it was a chance finding from our previous records that we had in the lab.
So I think comparison of 130 versus 16 is a bit
Yes, sir.
skewed. Second thing is what sort of retinal diseases were there? And was
So I've
there any
mentioned
differences in the pattern of the disease and your observation?
So in retinal diseases, we have taken mild NPDR, RP atrophy, Stargardt's disease. And so the sample study is much less as compared to the normal one.
But was there any difference between an NPDR patient and the other retinal diseases patient, findings wise?
So actually, the patients which were referred to us were directly from the OPD. So, so are you asking for the ERG, the VEP findings?
Yes, yes.
Yes, so they were different. I mean, the values were different.
Patient with NPDR and a patient with other retinal diseases, was there any difference in the finding?
Yes, sir. There was a difference in the values.
What was
but
the difference?
So the values for the latency and amplitude were different, but a common finding that we got was that though there was a reduction in the amplitude, the latency remained the same, which is what we found. Yes, sir, in retinal diseases.
So what is new in this, basically? What does this imply, or what is new in this your study?
So earlier it has been always said that for retinal diseases we would employ ERG, and for optic nerve we'll employ VEP. So through this study, though our study group is very small, it's just 16, we want to show that that if in retinal disease we get the latency to be much less, even though the amplitude is same. So an electric pathway is taking place, but we know there's V is equal to IR, there's an equation. So it's very unique to say that there's no relation between these two.
No, but
So-
you mean that if the patient is having any macular pathology and still the latency will be same as
So
a
that is
normal
what we have
person?
found out, and
It's same. A patient with macular disease, you have done VEP, the latency of that patient, and a normal individual, the latency of that, will that be same or will it be different?
no, sir, not with the normal individual. The normative data group shows a different finding, and the retinal disease group is showing a different finding. Here we are trying to compare between optic nerve disorders and retinal disorders.
So you mean to say that even with this, if a retinal disorder is suspected, yeah, you can perhaps
Use a VP for differentiation.
No.
But
VP will, VP for VP is for optic nerve, and for that your macular function has to be normal, right?
Yes, sir.
Because while doing VEP, we do a pattern stimulation of macula. So if your macula is not good, it will not get stimulated and the latency will not be normal. But you are saying that in your study it was normal.
and it just has an incremental value. I mean, if you have a OCT, I mean, a clinic that will have VEP will definitely have an OCT also, which will give more.
ERG actually.
but even then, we cannot compare with the ERG. ERG will give a lot of information.
Yes, so
All
ERG
the
is
layers
always.
that will give all the information about the layers.
So, but
Hey, congratulations on trying something new. You need to do more study and
Yes,
more
sir.
patients should be examined, and maybe next time you will have a more set of patients. Thank you.
thank you, sir.
Thank you, doctor.